Hello, you're welcome to Little Angels Corner, your favorite channel on parental tips for your young ones. My name is Dr. Stella. So, have you wondered which is best for your baby? Is it breast milk or formula milk? Well, today we're going to thrash that out. To start with, I'm a registered pediatrician. So, naturally, I recommend breastfeeding in the first 6 months of life. Exclusive breastfeeding. Having said that, I know that some other people may have some other opinion. Okay, so what are the advantages of breastfeeding? To start with, in this part of the world where finances are not that high, they are not that easily available, therefore breastfeeding is cheap, it's affordable, you don't spend anything extra, and then it is convenient and it is clean. And first and foremost, breast milk has already been packaged by nature. It contains all the necessary nutrients that the baby needs. In this nutrients package, we have fats, carbohydrate, proteins, minerals, and most importantly, natural antibodies from the mother to be given to the baby via breast milk. And then, what are the other advantages of breast milk to the mother? Let's start with the mother. After childbirth, the mother's uterus is enlarged and it needs to contract so that there won't be any bleeding postpartum. So when the baby starts to suckle on the breast, hormones are released, oxytocin, which causes the uterus to contract and therefore prevents postpartum bleeding. Also, the mother has put on a lot of weight during pregnancy, and after baby is born, she needs to lose some of that weight. She doesn't need all that weight. By breastfeeding, the mother is going to lose some weight. Breastfeeding also affords the mother and baby the natural bond which nature has created. When the baby suckles direct from the mother, there's this harmony, there's this natural instinct that bonds every woman to her baby. Research has also shown that mothers that breastfeed have a reduced risk of ovarian cancer, breast cancer, and also reduced risk of getting diabetes type 2 later on in life, even a reduced risk of hypertension. So, when it comes to the baby, what are the benefits? The benefits are also numerous. Apart from the bonding which I mentioned earlier on, the baby is also given natural antibodies from the breast milk. This is not available in formula milk. The baby is also given clean milk. There is no risk of the baby falling sick frequently because the antibodies that are passed to the baby boost the immunity of the baby and prevent infection in the baby, whether it's ear infection, chest infection, gastrointestinal tract infection. The incidence is very much reduced in breastfed babies. And also, breast milk contains 90% water, so that a baby that is exclusively breastfed doesn't even need additional water. In addition to all of this, babies that are breastfed, they absorb 90% or more of all the nutrients in the breast milk. and therefore digestion is easier. And you see that their stool is softer. It does not smell foul. And the breastfed babies move their bowels once in a day, once in 2 days. There is no cause for the mom to get alarmed because all the nutrients are being absorbed. Therefore, there is little or nothing for the baby to pass out. Now, also, when we talk about the benefits of breastfeeding, research has shown that babies that are breastfed are less prone to obesity. Babies that are breastfed turn out to be more intelligent. This is what research has shown. And then when we now talk about the formula feeds, when it comes to formula feeds, it's a bit cumbersome because you have to prepare the area where you want to prepare the baby's formula feed. It has to be a clean platform. The utensils, that is the feeding bottle, the teeth, all that has to be pre-sterilized and done in the best manner. The mother has to make sure she observes 100% hand hygiene, washes her hand, and the water with which she prepares this formula feed. Since the formula feed comes in powder form, the water has to be also very clean water. So all this may be cumbersome for some mothers, especially working moms. Formula milk has been prepared. The mother also has to think of adequate temperature, adequate storage conditions. All this is a bit cumbersome for the mom. And formula feed does not contain antibody like I have mentioned earlier. The manufacturers of formula feed try as much as possible to meet international standards so that formula feeds contain almost the same amount of nutrients as breast milk. However, it's not always 100%. And when the mother is preparing this formula feed, she has to follow the manufacturer's instructions. And this tends to vary from one manufacturer to the other. It's important to also state at this point that for formula-fed babies, when the milk has been prepared and the baby has been fed, whatever is left should be discarded. Because when you keep this milk over time, the bacteria in it multiplies. It's better you give the baby what you think he'll finish per feed and then throw what is left away. Wash the bottle, sterilize, and keep for the next feed. All this being said, however, it's important to also point out that there are some mothers that may need to forfeit breastfeeding and formula feed their babies. These mothers are those that have some chronic medical conditions, especially heart conditions, where it may be extra labor for them to breastfeed their babies. Mothers that are also on medications for various diseases, depending on what has been advised by their doctors. At the end of the day, it is left for each mom to weigh with her condition and also with the advice of her physician, her obstetrician, and pediatrician what is best for her baby. She should not take the decision 100% on her own. She has to consider the benefits of breastfeeding, both to herself and the baby, and she also has to consider, is she fit enough, 100% good health to breastfeed this baby? If it's going to jeopardize her health for her to breastfeed, she shouldn't hesitate to feed this baby with formula. At the end of the day, both breastfed babies and formula-fed babies turn out right. However, it is better to breastfeed the baby exclusively in the first 6 months of life if the mother's medical condition warrants it. So, I have tried to cover all the salient areas, but I'm sure you may still have some questions. Please do drop it in the comment section. I'll be sure to respond. If you have found this video interesting, do like, share and subscribe so that together we will grow a community of well-informed mothers with healthy children. Thank you. See you in my next video. Bye.